Dr. Anthony Fauci has announced that he will step down in December. He currently serves as the chief medical advisor to President Biden and as director of the National Institute of Allergy and Infectious Diseases. The 81-year-old has held the role in the federal government for decades, working under 7 presidents. So for more on this, I want to bring in Dr. Zeke Emanuel. He is the vice provost for global initiatives at the University of Pennsylvania. Dr. Emanuel, thank you so much. You worked as an advisor for the Biden-Harris transition team and the Obama administration, and you've known Dr. Anthony Fauci since the 90s. So you're a good person to talk about this. So Dr. Fauci has served under 7 presidents on both sides of the aisle. What are your initial thoughts on his legacy?
Well, I think his legacy is going to be twofold. The first is integrity and ethics. If you know Tony Fauci, you know that the man is incorruptible, that he does whatever is ethical. I initially began working with him on issues related to HIV/AIDS in Africa, ensuring that the research the United States funded there was ethical. And his one urge to me is just make sure we're doing the ethical thing. Tell me what it is and we'll do it, because he thought that was extremely important. His second legacy, I think, is just going to be his humility. He's a man who tells you the facts, tells you what he knows, and also, importantly, tells you what he doesn't know. And I think he is very, very clear about, I don't know that. Maybe there's some information I don't have. And so you can trust what he says in that context. You may not agree with all of his interpretations, but you know that they're very reliable.
Of course, when you hold a post like that for such a long time, such a public position, you're going to have critics. You're going to have to take some slings and arrows. And you wrote, along with Carrie Gross, a really interesting article in The Atlantic about the need for the NIH, the National Institutes of Health, to sort of overhaul the culture. And, the National Institute of Allergy and Infectious Diseases is one of those institutes of health. And I started to think about the ways in which Dr. Anthony Fauci has shaped the culture within that particular institution, for better or for worse. How would you describe it?
Well, our view, and I should say I worked at the NIH for nearly 15 years. I love the institution. It has given me a fantastic career. But I also think when it funds outside of the NIH, not inside the NIH, that it's lost a little bit in 2 main areas. One is innovation and funding innovation. And I think if you think about the last 20 years, CRISPR, these mRNA vaccines, the NIH wasn't at the cutting edge of funding those, and that's a mistake. The average age of researchers getting their first grant has gotten into the mid-40s instead of the 30s, where people are really innovative and creative. I think they need to rethink how they fund innovation. And the second area is clinical research. Most of the clinical research being done in this country is funded by drug companies. That distorts what's being done. It's mainly done for promoting new drugs, which we desperately need. But we also need lots of other kinds of clinical research. And the NIH has not done a very good job. And COVID actually showed that. And it's, I think, a challenge and a mistake. And so those are 2 big issues. But that's not, that's the director of the NIH has to get those priorities through, not the head of one of the institutes, which is not even the largest institute at the NIH. That's the National Cancer Institute.
So I'm curious about, when you express those concerns about the NIH, what was your take on how Fauci managed his own institute?
Well, we didn't go institute by institute to look at it. I've known Tony Fauci and the NIAID, as I say, for about 25 years, maybe a little longer. And we've always had very good relations with them. We've always had the fact that they really wanted to do the right thing. They have put together on the clinical side the HIV/AIDS clinical consortium to do clinical research. So I think that there's a lot to build on there. His successor is going to have very, very big shoes to fill, not only driving a research institute and advancing science, but also a man who can develop public policy, can guide presidents, can reassure the country. That's a hard combination to assume. Tony's done it tremendously well for the last 38 years.
Any idea where his replacement might come from within the Institute or beyond?
Oh, I think it's going to be a very wide-ranging national search. It's a very, very important job, and I think a lot of people will be interested in it. The NIH still has to have a director that's approved by the Senate. So, it's probably going to be a while before a permanent occupant has that role.
Dr. Zeke Emanuel, thank you very much.
Thank you.